To help us make sense of the data and the numbers, we have NTF Special Advisor Dr. Ted Herbosa joining us over the phone. Good afternoon, Dr. Ted. Is the recent case count already a cause for alarm as soon as now?
Good afternoon, Sean, and thank you for having me in One News. Yes, we're looking at numbers that have doubled since 7 days ago. No, we started with 100, which became 200, 300. And after 400, it jumped to 889 yesterday. So we have to be a little bit more cautious as this can increase into more cases in the next few days.
Right. I was monitoring tweets last night and I saw a tweet by Dr. Guido David of Octa. They have given some pretty grim projections by next year or even in the last few days of 2021. He did say even that projections or that the case count yesterday and the numbers actually exceeded his projections. What now are we looking at as the cause for the spread or the rise in cases?
Well, as of now, we still consider it to be the mobility of people as we celebrated Christmas with low counts as early as 2 weeks ago. We allowed people to go to the malls, to hold parties, and move about, no? But now we're seeing the hit of that particular activities, those are particular activities, and we now see an uptrend in all our cases, and even the admissions in our hospitals are also increasing as the days go on. So we've announced already caution to the public as early as yesterday to actually remember the minimum public health standard, continue to wear our face mask and observe the social distancing, and of course the vaccinated only in eating places indoors.
Right. With regard to masking up and keeping ourselves safe, now that this new variant is spreading all over the world, what do you recommend we do with our masking policy, Dr. Ted? Do you recommend double masking or upgrading to an N95 or equivalent masks?
Up to now, we still will not change particularly the mandates. The president actually recommended returning the face shield, but I think as long as the Omicron variant has not entered, I think our regular surgical and N95 mask should be working. We can double mask for additional protection, especially in high-risk areas or areas where the chances of getting infected are higher, like in crowded places and in places where there are lots of people that your status of vaccination is unknown. So I think we can do more measures by trying to not bring our young children out because they're unvaccinated. Although most of Metro Manila are already vaccinated, we still have a proportion, like the below 11 years old, that are still unvaccinated. And of course, the virus will look for the people who are unvaccinated and then spread them again to those who have been vaccinated.
Right. Well, it seems a lot of these cases actually, Dr. Ted, are in vaccinated people. Having said that, should we, worry a little less because these people who are infected as early as now are fully vaccinated, or what should be the protocol now? Because the previous surges, a lot of people were not yet vaccinated. The only difference now is that people are vaccinated in the face of this very highly transmissible Omicron variant. How should we, conduct ourselves in terms of managing our anxiety and our panic?
Well, that's a good thing, no? Having been fully vaccinated allows one to be protected from serious illness or even dying. So it does not protect you from getting infected. Being fully vaccinated will prevent you from getting serious illness or the risk of dying. So, as you know, Omicron has gone around the world with hitting even people who are fully vaccinated. And what we've done is we've decreased the months or the interval for the booster dose. So it used to be 6 months. Just a couple of weeks ago, we decreased that to 3 months only. So people who've had their second dose in September can actually get already the booster dose for additional protection. Because what we're finding out is that people with 3 doses fare better with the Omicron than just 2 doses. And for those who have 2 doses, I think the 2 doses are enough as of now, especially if it's less than 3 months, because it will still protect you from serious illness. So very important, if you're not vaccinated, you better get vaccinated. There are relatives who are high risk. Convince them to already get vaccinated because that Omicron variant is really going to come here.
Right. Dr. Ted, will you be recommending for the NCR as well as other at-risk areas to shift back to alert level 3? I know we are at alert level 2 until tomorrow, December 31.
Well, the recommendation of the National Task Force is to keep it at alert level 2. Remember, this goes with localized lockdowns. So we are telling local government units or local chief executives to actually monitor the barangays or the houses that have a high number of cases. And true enough, Sean, we're seeing in the hospitals families, cohorts of families that are getting positive. So these are the family reunions that happened in Christmas or before Christmas that has led now to infections coming into the hospital. So we're seeing this. So we make sure that these homes or these houses and neighborhoods are maybe locked down, localized lockdown, so that the whole city and the whole metropolis doesn't have to lock down.
Right. Well, just like you said, tomorrow is New Year's Eve, and families for sure will again be gathering to celebrate the end of the year and the new year ahead. What can we do? Because we cannot stop these gatherings from happening for sure. But what are some reminders that we can keep top of mind?
Well, my precautions to our televiewers here is that if you have symptoms, cough, cold, sore throat, fever, I suggest you do not join any of this New Year's Eve celebrations and just stay home and isolate and treat yourself. The other one is making sure that family gatherings, if they're big, that you let people who are fully vaccinated to attend it. Maybe the partially vaccinated or the unvaccinated can just join on a blended format, like via teleconference. And then if you're going to have a party, make sure the party has ample space. Holding it outdoors, if you're going to hold it indoors, make sure the windows and doors are open so that there is very good ventilation. And continue to wear the mask. I think if there are people from outside the household attending a party in your home, continue to use the mask, wash your hands, use alcohol, so that we can still follow the preventive measures of transmission.
Thank you so much for the advice and the insights and the time. Dr. Ted Herbosa, NTF Special Advisor. Thank you, sir.
Thank you, and Happy New Year to you, Sean.